Welcome to Connected Care and Education Learning Workshop, Unit 004, Outcome 2, Part 22, Changes in a Child or Young Person that would give cause for concern. Changes in a child or young person that would give cause for concern. All children develop at different rates, and what is considered normal for a younger child may also be normal for an older child. Children constantly change and develop. There will be a lot of changes in behaviour and growth during adolescence, their time in school, or at times when there are changes at home. However, some changes will give cause for concern. It is important to recognise and respond to concerns in order to ensure that the child or young person receives the help and support needed. The earlier concerns are identified and reported, the sooner help and support can be put in place. Unreported concerns have a negative impact on outcomes for the child or young person. Some causes for concern may include development that is not consistent with expected milestones, delays in one area of development not consistent with development in other areas, regression, e.g. a child reverting to wetting themselves, wanting a dummy, change in behaviour, e.g. becoming withdrawn, aggressive, showing signs of anxiety or depression, development of fears or phobias, less active, more lethargic than usual, acting much older or younger than their age, a change in eating, sleeping, toileting habits, excessive weight gain or loss, sensory difficulties, developing sexualized behaviour inconsistent with their age, injuries inconsistent with their age or day-to-day activities, being unwilling or to undress in front of others when they have previously done so, developing speech disorder, being dirty, unwashed or hungry, irregular attendance at a school or setting. Please pause the video and open 004 Learning Outcome 2, Part 22. Once you have completed the worksheet, please continue the video. Observing, monitoring and recording the development of children or young people. Observations of children support the practitioner to learn more about children and in turn to work more effectively. It is important to regular observations of children and young people are recorded for a number of reasons. To monitor development, considering developmental norms. To monitor children's progress in relation to curriculum frameworks. To identify strengths and weaknesses or any areas of development that need support or stretching. To identify changes in pattern of development. To identify when support from another professional may be needed. To identify a child's interests which may enhance the learning process. To assess the effectiveness of activities in supporting development. To consider how children are using the environment. To help understand the child's behaviour. To inform and adjust planning to meet the needs of children. To support the planning cycle of plan, implement and evaluate. To be able to share information with parents and inform them of child's progress. Practitioners should work in partnership with parents and use their knowledge of the child. Provide information to support transitions. Ideas can be shared about how best to help a child settle and activities and resources that may help them settle. To help practitioners reflect on their own performance, their impact on the child's learning and behaviour. Further information on observing children as part of the foundation phase can be found in the document Observing Children. There is a link for you to be able to visit. Please pause the video and open 004 Learning Outcome 2, Part 22, Worksheet 2. Once you've completed Worksheet 2, you will have completed Learning Outcome 2, Part 22.